So we're on strike today because the government has fundamentally cut our pay over the last 15 years by about 26%. This is resulting in junior doctors leaving the profession and going to other places like Australia, New Zealand, Canada, but also leaving the medicine industry altogether and going into places like the city or pharmaceutical industries. I think we're striking for us, but we're also striking for our patients. I think at the end of the day, when you decimate the pay as it has been over the last 15 years, you lose the ability to retain doctors, you lose the ability to staff a hospital properly, you lose the ability to run a health service properly. This then impacts patient care, it impacts our ability to provide the care that we want if we're running short of doctors, and that in turn has a knock-on effect to the general public and our health service. So this strike isn't just about restoring our pay, it's about us striking to preserve the health service for what we want it to be, which is being able to provide good quality care and having care free at the point of use. I think what we want is the government to come forward and have meaningful conversations with us. We want them to listen to what our demands are, which are to just see that our pay is restored to what it should be in keeping with year-on-year inflation. So that is a 26% pay cut over the last 15 years. We are asking for 35% to reflect that. However, this is to just show us what we are worth, give us our value. A junior doctor nowadays, when you graduate and you start in your first year, is on £14.09 an hour, and that is not a lot of money. People argue the case that you can progress your career and go on to become a consultant in 8 to 10 years' time, but we've got some of the brightest people in the country becoming doctors, and to pay them less than what you could earn in Pret pouring coffee, no disrespect to the workers over there, they do an important job too. I think it's time to pay our junior doctors what they're worth.